Say hi. Okay.
We'll look at the toys in a minute.
Well, good afternoon. It's great to be back in Northeast Florida. I want to thank Sally West, Regional Director, Walgreens Government Relations. Do we have Joel Slocum here? No? Okay, thank you. Joel's the Regional Pharmacy Manager for Walgreens. Is Jason Fisher here? Jason's not. He was going to be. Is the mayor here? I don't think so. Doesn't matter. I already told the mayor what we're doing. So today is exciting because we are going to be able to expand the Walgreens footprint for COVID vaccines in the state of Florida from 12 stores currently to 97 Walgreens stores statewide. But the great thing about it for people in Northeast Florida is that 16 of those stores will be right here in Duval County. The rest of the stores are spread across 18 additional counties, 3 in Alachua, 1 in Bradford, 5 in Charlotte, 5 in Citrus, 1 in Clay, 9 in Collier, 1 in Escambia, 1 in Hendry, 1 in Lake, 8 in Manatee, 12 in Marion, 1 in Nassau, 4 in Palm Beach, 13 in Pasco, 8 in Polk, 2 in Santa Rosa, 5 in Sarasota, and 1 in Sumter. So appointments are open today, and the shots will go in the arms starting tomorrow. So to make an appointment for a COVID vaccine at a Walgreens, visit walgreens.com. You click on the COVID symbol or whatever they have up there for that, and then it'll go through. So we appreciate Walgreens, the partnership. I can tell you, if you look, whenever we've put a lot of retail pharmacies in places, I mean, the numbers go up because this is what they do every day. And so when you're talking about, we did Publix initially, then we've been able to do CVS and Walgreens as part of the federal pharmacy program, also Winn-Dixie and Walmart. It's made a really big difference in areas that have had that coverage. You've seen the numbers go up really, really well. And I'm excited because if you look at some of the progress we're making. We have close to 3 million seniors that have gotten shots in the state of Florida. If you look last week, because it takes some time for these shots to populate, we were doing a total of 160,000 shots some of those days last week between first and second doses. We were doing 100,000 first doses a day on average last week, certainly Tuesday through Friday. Just Monday and Tuesday of this week, we were already reporting 85,000 initial doses given. Those numbers will grow as the reporting comes in. And so we can say we'll have 3 million seniors. We may even already have that with the lag in reporting, but clearly this week we'll have done 3 million seniors. We'll have done over 60% of all seniors in the state of Florida. And I think it's worth pointing out, North Florida has really done a good job in getting coverage to senior citizens. If you look, St. Johns County, 79% of their seniors have gotten a shot. Wakulla, closer to Tallahassee, 76%. Nassau, 74% of seniors in Nassau County have gotten at least one shot. Leon, 74%. Santa Rosa out in Northwest Florida, 69%. Alachua, 69%. Franklin, 67%. Gadsden, 66%. Okaloosa, 66%. So those are some really good numbers. And I think what we found is as you get into that 2/3 of coverage, the demand really does start to go down. And part of it is some folks just don't want to get the vaccine, which is their choice. We're not doing any mandates. So as you do that, it really does make an impact. I can tell you, we have some stories on this with the retail pharmacies and the impact they've made. When we put Publix in Palm Beach County, I went and met with the mayor, the county, the commissioners. I said, okay, you guys are lagging. This was very early on. I was like, what can we do? Do you want to do sites? Do you want to do this? And I told them we were doing retail. We started with Publix. They were like, look, we've got 65 Publix. 90% of our seniors live within 1.5 miles of that. If we do that, it'll be easy. So we put it in, and their numbers went very high. So now they're about 70% in Palm Beach of seniors have gotten shots. We did CVS, EMOS, and Navarro Pharmacy in Miami-Dade. And since that's happened, Dade went from below average for senior coverage to above or pretty close to the state average. They're almost 60% now in Dade County, and that's a lot of seniors. I mean, you're talking about they've done about 300,000 seniors in Dade County. But that's because you have a place like Walgreens. It's in your community. You go And if they can do 50, 80 shots a day, what do you do, 80 shots during the week and 60 on the weekends? Multiply that across a county like that, and the numbers really, really go up. We're also proud of our rural outreach, because if you look at the coverage rates for seniors, we have one county that has more than 100,000 people who doesn't have at least 50% of the seniors having received shots. That's Hernando. We're working on that. Part of that is, I think, some reporting issues. We have surge vaccine there. We're going to do more. All the rest that are below 50 are more rural counties, and so we've done a rural outreach. And here's how it works. Highlands County, I was there last week. We surged more vaccine there. They were at under 40% of coverage for seniors. Now, not even a week later, they're at 52% in Highlands. And so the rural counties, you can really make a big difference. We were just in Lake City. We did an extra 1,000 of the Johnson & Johnson shots in Lake City. So that will be easy for the folks. You do one shot, you don't have to worry about it. So we're going to see those numbers. We're also working in Dixie and Gilchrist, Putnam, all those counties to be able to get those numbers out. But I think if you look at some of these major counties, I mean, Duval, 1 million people in this county, and you've done 63% of the seniors, almost 100,000 seniors in Duval have gotten shots. Obviously, I mentioned St. John's, which was very good. So we want to build off the momentum, and I think what's going to happen, we have more supply on a weekly basis than we did at the beginning of January. I mean, people, you guys remember, it was like to get an appointment was like winning the lottery almost, because there was 260,000 doses a week for a state of 22 million people, 4.5 million seniors. And so as we've increased that, as the federal pharmacy program has ramped up, that gives us more opportunities. So when people go online to try to get appointments, it's actually something that's much easier to do. And if you're 10 minutes late when the window opens, there's still appointments available. Early on, they'd open a window, and there'd be thousands and thousands of appointments that would just be taken up within 10 minutes, 8 minutes sometimes, just be gone. So that's good. So what's going to happen is Monday we're going to moving the age down to 60. So 60 to 64 will also be eligible. Come in here just like anybody else has been doing, all the seniors. That's between 1.5 and 2 million additional Floridians that will be eligible. Now, there have been some Floridians in that age group who have been vaccinated, because we do comorbidities, we do the healthcare workers, we've done law enforcement, we've done teachers and some of that other stuff. But by and large, that's going to be a pretty decent expansion. There's going to be some folks who are chomping at the bit, so they're going to be able to do it. The good news is today's expansion of the retail program, we think we're going to be able to expand even more next week, and we'll have an announcement about that. So I think what we'll have is pretty much any community with a decent size, there's going to be multiple retail options for you to be able to go in and do it. And I think that's going to make a huge difference. So then we do the 60. Then our next step will be lowering the age to 55. I will announce that hopefully relatively soon, because I think we're making a lot of progress. And then once we do the 55 and up, we probably would be able to really open it up more broadly if the supply continues on the way we're doing. And I think these pharmacies are really going to play the dominant role in getting the shots into the arms. Yes, hospitals are doing it. Yes, we have sites, we have county health, we have some of that, and it's important. But I tell you, this is very easy. It's in the communities. They all are doing 50 to 100 shots at each place every day, and multiply that by hundreds, if not thousands, of stores across Florida, and those numbers go up very, very quickly. So we're excited about the progress that's been made in Duval. We're also excited about putting seniors first. Man, the number of folks we have, and we're a huge state land-wise. It's not just population, but the seniors, it's not like they're all in Boca Raton. They're in the Panhandle, Northeast Florida, Central Florida, you name it. So we've had to go to all these places but to be here on the cusp of 3 million seniors. Again, we don't know what the actual demand is ultimately going to be. I think we'll probably get to 2/3 or 70% that will definitely want it, maybe a little higher. But I can tell you in the counties, once they get to that above 70, the demand really does start to peter out. So we're pretty close to where we would be, where we really want to be with the seniors. And I think it's bearing out in some of the numbers. If you look, we've put seniors first, and our hospitalizations for COVID among seniors are down more than 75% just since February 3rd. So that's a tremendous trend. The admissions are a fraction of what they were at the beginning of January, and those admissions were less than what they were over the summer. 40 states have suffered higher COVID per capita mortality among seniors than the state of Florida has. Part of that was focusing on nursing homes, testing seniors, and then now vaccinating seniors. But we really feel like we've made a lot of progress there, and we have more to do. We're not done, but I think that with the hitting millions of seniors like we have, that's exactly what we set out to do. And if you look around the country, we're near either the top or near the top in the percentage of all doses that have gone to seniors. We're over 70%. The number of seniors you've done, and then the percentage of seniors who have been vaccinated. So we're going to keep up that progress. So Walgreens.com, if you want to make an appointment, and people in Duval County, you have an opportunity to go on now, make that appointment. You could be getting a shot tomorrow here, and we want to do it. Now, they will use all 3 vaccines as they get them. So a lot of the pharmacies are getting Pfizer, some are getting Moderna. There was some J&J as part of that, I know for some of the pharmacies. But the J&J, just that first tranche, and now it's kind of nothing for a little bit. So we don't think we're going to get any new J&J next week, but we do think beyond that, we'll start to see the J&J ramp up. So I think you guys will be able to offer all of them. And, you know, I didn't know how the J&J was going to be received. I thought it should be received very well because I think it's a really impressive vaccine. But some negative reports about it saying it wasn't as good, all this other stuff. But I can tell you, there's been strong demand for J&J. We opened up a senior J&J drive down in Sumter County yesterday. A lot of people wanted to do it. And then we went to Lake City today. We did the 1,000 J&J. And there were some seniors that were waiting for J&J. So it's good. So we want all of it. And, you know, the pharmacies, they can handle Pfizer with the freezing, Moderna put in the freezer. That's not a problem for them. But, you know, having a J&J is pretty versatile. So we're looking forward to that. So Walgreens.com, if you want to do the other pharmacies, Publix.com/COVID vaccine, CVS.com, Walmart.com/COVID vaccine, and then Winn-Dixie.com/pharmacy/COVID vaccine. So a lot of options, but I would just remind everyone, I know some counties sign people up, all that. I'm not saying don't do that, but you can still try to get in at a retail. And because these retail, they're doing a lot of shots, and so don't forget about that and make sure that you're doing that. Also, just like to point out, you know, we're really proud of having kids in school in Florida, and we think it's very, very important, you know, to look around the country and to see places where it's like they have been out of school for a year and with no end in sight. That's going to have a lot of long-term damage. But we're also happy about what we've been able to accomplish. So when U.S. News and World Report education rankings, Florida is now number 3 overall for pre-K through university. We're number 1 again, and we've been for a number of years, for the top public university system in the country under U.S. News. But the great news is, when I became governor, we were ranked 40 in pre-K through 12 by U.S. News. 2020, we got it down to 27. March 2021, with the new rankings, we're down to 16 in terms of the top pre-K through 12. So number 1 in universities and public universities, 16 pre-K through 12, number 3 overall in the country. That's pretty good. And I got to think that these NAEP scores and everything, as all the dust settles from this, the fact that our kids have had the option to go to school, that's going to benefit them. Some of the other areas where they didn't let them go into school in person, they're going to see big achievement gaps. And look, it's unfortunate. I mean, I want Florida to do well, you know, not necessarily on the backs of states that have mishandled it, but because those kids, I think, are going to suffer. But I think we've provided opportunity to a lot of students throughout Florida, and I'm just happy that they're able to thrive, and I'm happy to see the progress that the state of Florida is making on education. With that, I'm happy to take some questions.
Governor, you mentioned next week you're going to expand a little bit further, 60, 64, and then after that, 55 and older. You said soon. Do you mean this month or?
It will definitely be this month. Yeah, I'll get you the exact date. I mean, basically, what we look at the coverage rates in each age group, and then we look at the vaccine supply, and you can just make the judgments. With the current vaccine supply, the coverage rates for seniors are going very well. Obviously, you throw 1.5 million to 2 million people into the mix. Not all of them want it, and every year you go down in age, there's a touch less demand for it, but we're going to get a sense when the sign-up's there and see where it's at. But if the supply continues going good, I think for sure, we're going to see the 55 age in March. And hopefully sooner rather than later. But as soon as we know, as soon as we get the allocation in the system and we know what's happening next week and the following week, and we can see that there's going to be enough, we'll pull the trigger on it for sure. There was some saying like, when do you lower the age? And we just said, look, we're just going to look for the demand signals. And if I get reports that some of the appointments, they have to reach out to fill them, that's when we want to do it. And so we saw the coverage rates. We saw the demand signal being a little bit weaker over the last week or so. And so now we're doing 60. The demand will pick up because some of those folks have been waiting. You'll start to see that and then get a sense of by the middle of next week, we'll see, okay, how many people are really doing it? Are these places really jammed? I don't think it's going to be like the end of December, beginning of January when it was like, it was like the iPhone times 10 coming out to get these appointments. I don't think it's going to quite be that way, but I do think you're going to see some pent-up demand for folks in that 60 to 64 age group. But we will do 55 this month. I'm pretty confident, unless there's some major change in the vaccine supply, and that'll be exciting. And the fact is, you are more at risk at 56 than 26. There's no doubt. Now, you're much more risk at 76 than 56, but we get everyone over 55 who wants it. When you start getting under 50, the mortality is just so low, absent comorbidities. And of course, the comorbidities we've had from the beginning. We've had hospitals doing comorbidities from basically December 23rd. They've gone, if they have a cancer ward, they're doing that regardless of age, and we obviously support that. Yes, sir.
Two things. Are you surprised at the low turnout here at the federal site here? It has been extremely low in the satellite site. And also, what's your reaction to the CDC's recommendation of opening up nursing homes?
So, we want nursing homes open. We've done that in Florida. They're vaccinated. We vaccinated 4,000 facilities. Walgreens helped us. CVS helped us. We had strike teams doing it. But as you know, we had visitation going on already. The isolation is devastating for these seniors. And yes, it's a serious pathogen. These are the folks who are the most vulnerable. We did a lot. We stopped the visitation early. We protected seniors from being sent back to nursing homes. Obviously, we're seeing a lot of some of those states that did that. If you look at the highest per capita mortality in the country, it's almost always linked to a policy of sending the contagious patients back into nursing homes. Florida banned that, and I think we mitigated as a result in doing it. And you need to focus on that. But now that you have the vaccines, they need to live life. Let them make these decisions, and so we have no restrictions on that. We want them to be able to do it. And I can tell you, we had to make the decision many months ago to get the visitation in. And when we did that, the amount of joy that brought to so many people was unbelievable. And they were able to hug people. They were able to be with their families again. And it's like, I'd had some of these people in their 90s tell me, like, look, I don't want to get COVID, but I need to see my family. I got to live my life, and I don't want to just be cooped up in here. So we're 100% want to do that. I do worry about liability for some of these nursing homes. I don't think it's fair if the nursing home residents are living a normal life and someone, because, look, these vaccines are very effective, but it's not like no one could ever get infected, or not all seniors are wanting it, even in the nursing homes. I don't think that should be a cause for liability. I just think, like, if you're doing basic stuff, let people live and do that. And what was your other part of the question?
It was the federal...
Oh, yeah. So they're doing it kind of on their own way. That's not something we're rostering. They've done it a little bit different. So for us, we've rostered things a number of ways. Through the pharmacies, they have the website. You go sign up. If we have a drive-through site, we either do a phone or an online sign-up to try to have reservations so that people aren't waiting in line for forever. We haven't really done walk-up sites because with no reservations, because we've felt that there was a lot of demand. Now, that may change and there may not be some areas, but I think what they're doing, they're not doing reservations. They're not necessarily, it's open, but like they're not advertising it to the whole public. They're going in certain areas that are underserved. They're knocking on doors. They're asking people to come. So they've had some success in it, but I don't think they've had enough uptake to be able to fill out all those spots. Now, we're going down to 60, so they're going to be obviously able to do more in that regard and do it. But that's kind of the way they're approaching it. And look, I think it's worth trying that way. I'm not sure that it's had the positive results that they were hoping for, but it is a different model than what we've done. Now, we've done a lot. We were the first state to do churches. So we were working primarily with African American churches. That's the beginning of January. We'd partner with churches and we'd say, okay, roster people for us. How many can you get? We'll come and do the vaccine. So they'd have hundreds of parishioners. You show up on a Sunday, you vaccinate them. Same thing with our senior communities. A place like Century Village in Deerfield Beach. Say, how many seniors want it? How many you got? Okay, 4,000? All right, we'll bring 4,000 over a few days and we'll knock it out. That makes it easier because they're the ones that are getting their folks in line, and the seniors don't have to navigate necessarily a system. So there's a lot of different ways to do it. There's pluses and minuses with all of them, but obviously the demand isn't what we thought it would be. Yes, sir.
Question kind of very different. Does the state have like an actual formula that it uses for deciding allotment
So this sheet is the sheet we look at the most. So it's vaccination coverage in adults 65 years plus. The health department compiles this. We get it every morning, and it lists every county, the total population, the 65 and up population, and the percentage of population 65 and up who's been vaccinated. And so that's kind of, so if you look, some of the areas that we've been working on specifically lately, it's really made a difference. So we went in, I mentioned we went into Highlands County. They were lagging. They were one of the worst. They're now close. They're getting close to the middle of the pack. They're 52% of seniors. If you look at Manatee County, they were close to the bottom. We went in, we did 2 residential sites, and then we did a retail pharmacy expansion. They're now at 55%. They were at like 25% a couple weeks ago. If you look at Pinellas County, same thing. We went to Mainland's community and then expanded some of the allotment there. They were lagging. They were in the 30%. Now Pinellas is over 50%, and that's a very heavy senior population. So we appreciate that. Sarasota County. We work with Senator Gruters. He said southern part of the county isn't getting enough vaccine. So we surged it there. They were in the bottom 10 counties for senior coverage. Now they're 60%, so they're one of the top 20. So that's pretty much what we're doing. We're trying to figure out where there's a lot of seniors that haven't been vaccinated. And sometimes we don't have a lot of extra vaccine, but as we're doing it. And we've also worked with the pharmacies to try to make sure that there's retail coverage in as many parts of Florida as possible. When we started with the Publix, we had the hospitals were getting most of the doses at the time. So the big urban areas that had big hospitals, hey, you came, good. So, Miami, Orlando, all those places, Duval had big. We tried to get it outside of those areas in medium-sized places with a lot of seniors. And so we did that, we'd expand it. But then as it got to the point where we had opportunities to do even more retail, well, Dade didn't have a lot of retail. So we put in the CVS EMAS in Navarro. We did the Palm Beach Publix, which is a big deal. So we're just trying to figure out where the gaps are. But I would say this is kind of what we look at, is the vaccination coverage in adults 65 and up. And in fairness to some of this, there's counties that we've reached out to who are very low on this, and we've asked, you want us to do another site? We'll do it. And they say, we have a tough time getting demand right now. So there's some that have underperformed. Some of that is not necessarily because of supply. Some of it is because of demand.
So basically, though, basically, this is something where it's not a fixed formula you guys are working on. You're trying to get results.
Well, it's looking at this coverage. This is obviously very fluid, and it goes up and down, and so that's where we're looking. But I would say, every single place where we've been able to really, expand a footprint, do a special site, do more with the faith communities, you do see it in the numbers. And I think the retail is great. So I think what you're going to see in Duval with these sites, with the Walgreens, you're going to see the seniors get up to about 70% very soon. But then the 60 to 64, I think you're going to see those numbers really pop here in Duval County, and I think it'll be really, really good. One more, yes?
Follow up on nursing homes.
Sure.
So we just talked about, so the Centers for
No. We've had visitation for a long time. We want them to do whatever's best for their residents. And so if there's anything they need us to do, we're happy to do something for it. But this is all about the well-being of those residents and making sure that, yes, take steps, which we have done, to protect their lives. Florida was the first state to vaccinate nursing home residents because the CVS and Walgreens, their program started basically a week after the first vaccines hit. And so, which was fine. I mean, that's what they had planned. And we said, you know what? We got to go. So we did 106 nursing homes in Broward and Pinellas with our strike teams, first one on the ground there doing it. So we've done all that. All 4,000 facilities in Florida have been offered a vaccine. Now, most seniors have taken it. Not all of them have, which is fine. But they have done that. We've done things to offer the protection, and now protect life, but also make sure it's a life worth living. Make sure they have fulfillment. Make sure they have the ability to work with, see family members and do all that. And when you reunite, I mean, we had stories when this first started of family members not being allowed in. We had a lady, great lady here in Jacksonville. Her husband was in a memory care facility, so she got a job to work there just so she could see him. And so these are things that we want to link people together. We want that. That's a very important part of living life. And isolation is very, very destructive. And the thing I hear, I was just talking to a friend of mine who was in D.C., and he's like, the difference between Florida and D.C. is like, it's dead. It's totally dead. Here, people are living life. They're happier. And things are you just want to be here compared to that. And I think that has an effect far beyond these nursing homes and there, but I think it's most acute in the nursing homes. So God bless those nursing home residents. They've been through an awful lot over the past year. But yes, we got to do whatever we can to bring fulfillment to them. So if any of those facilities have any need for the state to help them out on any of that, we're ready, willing, and able. We were the first with the testing. We were the first with the protections against the discharges into the facilities, first with the vaccines, and we want to be first to help them reach the fulfillment that they need. Thanks, everybody.